I get it. They're scared and they want the best for their patients, and I absolutely agree. But I wonder at the motivation.
Health Minister Cameron Friesen is facing backlash after he questioned the motives of over 200 doctors who wrote a letter indicating their concerns to the province.
It came across as speculating what docs were trying to do with this, which was unfortunate. And I think if one looks at the lot of that has been written about this, I think most people found the response to be appalling.
Dr. Jacobson, one of the authors of the letter, says it was written in a day or two and sent out as recommendations from frontline workers, without the intention of undermining anyone. It garnered this response from the health minister.
To produce that letter, to generate it at a time when they knew it would have maximum effect in causing chaos in the system, when Manitobans need most to understand that the people in charge have got this.
Opposition parties don't believe that the PCs have got this. Liberal leader Dougald Lamont has called for Friesen's resignation. Official opposition leader Wab Kinew tweeted in part, instead of attacking them, the minister and the PC premier would do well to listen to their advice. The province's top doctor says he takes the letter at face value, that doctors are concerned.
We are at a critical juncture right now. And so that letter from physicians is consistent with that. That we Manitobans need to act now. We need restrictions in place, and we've definitely heard that many Manitobans are struggling with these restrictions.
Dr. Jacobson hopes the minister and doctors can move on from this, and that the health minister will act on some of the letter's points.
When things are changing so rapidly on the ground and frontline workers are exposed and as they are to the issues and are living the system, I think it's pretty reasonable to respond. And I think in a democratic society, in a public healthcare system that's open to give and take an opinion, one should feel perfectly okay and non-threatened by providing input. You take what you need, you don't take what you don't need or what you disagree with.
Minister Friesen addressed his remarks in the House Wednesday.
If these doctors are expressing they aren't having confidence, we need to change that. That is why we've committed to provide a technical briefing at a level of detail that the doctors have not seen before. That we will give that to doctors, let them see that plan, let them have confidence in that plan, because, Madam Speaker, now more than ever, Manitobans need to have confidence.
In Winnipeg, Mike Albanese, City News.